My name is Cindy, and I will be 60 in about 2 weeks. And back last April, I'm a flight attendant. I was working a trip, 2 trips, 6 days, and my right arm began to hurt. And by day 5, I could not lift my own roller bag, and so I knew I had a problem. I thought I just had a pulled muscle, so when I got off the trip, I iced the arm and took some ibuprofen and tried to medicate myself, and I quickly realized that that wasn't going to work. So I had to call out sick for my next trip, and I made an appointment to see an orthopedic doctor. On that visit, he felt like I had it was more of a neck issue than an arm issue, but all of the pain was in the back of my arm and my tricep area. And so we tried ibuprofen and icing it, and he told me he'd see me again in a week. But I made the decision that I needed to inform my company and that I work for, and I went to see the company doctor. I saw the company doctor for approximately 2.5 to 3 weeks and did some physical therapy. Wasn't a lot, but some. And he made the decision to order an MRI. When the MRI came back, it showed a tear in the tricep area of my arm, and he referred me to see a surgeon. So then I began seeing an orthopedic surgeon, and it wasn't until July that I was able to see one. And I saw him through the summer. The only treatment that I received was some physical therapy. And I was going to physical therapy twice a week for about 2 hours each session. Because of the waiting period that it took to get approval to see the doctor, my arm actually got worse. The range of motion got significantly worse, and the pain was much worse. And I couldn't reach behind me. I had trouble pulling a shirt over my head, dressing myself, and just doing various activities in my home. I favored the arm tremendously. This went on for a period of time, and then I was sent for a second opinion with an orthopedic surgeon, and he determined that there was really no injury, that it was basically my age and that I shouldn't do my job anymore. So at that point, I was not willing to accept that, and I ended up here at Magnolia, and I had previously come in and kind of checked things out, and I really liked the staff, and I liked the philosophy behind the whole practice. And so I began treatment here on December the 5th, I believe, and it was a holistic approach to treating my arm, a lot of rehab, and we did do some injections and a lot of exercise and just one-on-one with the great staff here. Slowly but surely, I began to see an improvement in my arm, and I was able to do the things that I had not previously been able to do, pulling a shirt over my head, reaching around behind my back to hand my granddaughter something to drink in the car. That was big, because at one point I could not do that without excruciating pain. And slowly and surely it just began to get better and better and better, and I was finally released this last month and was able to return to work full duty with no restrictions. And I have just completed, over a period of time, I've completed about 8 days of flying, major flying, and I've been able to do all of my duties that are required, and everything's fine. My arm is back to normal. I'm able to lift. I'm able to do all of the things that I could not do previously, and I'm very, very happy about that. It was definitely worth my time and money to come and be treated here. If I had been able to come here from the very beginning, I would have never been off work for 10 months. I should not have been off that long, because when I came here, I got 40 treatments, and so that's about, 3 months, I guess. That's significant, because I I'd already had a lot of physical therapy up to that point, and I wasn't anywhere near to the point of returning to work. I love the approach here because it's taking care of your problem and your needs, and it's not a bunch of medication. And I've learned how to do better for myself, better posture, better exercises to do for the rest of my life, and preventive measures so that I don't re-injure the arm or even my other arm. I've got some tools now to use. I would recommend Magnolia to anybody because of the staff here. The staff is wonderful, and I think they listen to you. I think they spend a lot of time conferring with each other to how they can help you better. And if I didn't think that I was getting something that maybe I needed, they were on top of it and took care of it. It was a joint effort, me giving information as to how I felt, and then them coming up with a plan for me, not everybody, but for me. And I would highly recommend it. In fact, I want my husband to come.